actually a telemedicine, telehealth company with a different spin, not like Teladoc, but we'll talk a little bit more about that. And so those three came together to form Arkos Health, and so we provide solutions for payers, but for health plans to manage their high-risk populations, to make sure that we can deliver impactful outcomes for patients, make sure that we can support the families, and with the long-term goal in mind is to drive the cost down and improve quality for the populations that we serve. And so when we started the pandemic, okay, we started looking at technology. We started looking at other telehealth providers. And we did this merger within last year when the pandemic was at its peak. Okay, we saw the value of a telehealth company and we added it. And so that's what we do. And you know, if you ask, being a physician, if you ask 5 different doctors, they'll give you 5 different opinions. Okay? And so what you're going to hear today is my opinion on telehealth and really telemedicine. Okay. So, can we get the slides up? Okay, so we'll kind of briefly just talk about the history, market size, some of the issues to consider, because anytime you have new technology, you open up the floodgates, there are a whole host of issues that you have to consider. Okay, so we'll talk about that. We'll talk about COVID-19 especially, and how it's kind of changed providers' behaviors, payers' behaviors, even patient behavior. Okay, and we'll talk about that. And then a little bit about the future of telemedicine, and I already said, you know, issues to consider. So if we take a look at the history, okay, everybody knows who invented the telephone, right? Tele comes from the Greek word, or tele comes from Greek, means far. And we're all infatuated from doing things from afar. So television, okay? A lot of you sit in front of the television. I know I do on Sundays to watch football. I don't go to the games. I don't pay the high prices, right? Telemedicine. It's been around since the 70s, okay? Or actually the 60s. And we'll kind of give you a timeline. But one of the things that's important in the space to understand is that the proliferation of any technology, okay, is surrounded by 3 things. One is curiosity, right? Where do the ideas come from? The next is the actual innovation. And the third is need. So if you go out to the exhibitor hall out there and you look at all the solutions people are providing, they're all trying to fulfill a need, okay? The human body hasn't changed for thousands of years. What has changed is our environment. What has changed is innovation. And as people innovate, they come up with new ideas, we find out that we have additional needs that we didn't even know about. And so everything that we do in healthcare is in a triangle of cost, quality, and access, okay? You guys are familiar with the Bermuda Triangle, graveyard for airplanes and ships, okay? Well, healthcare's triangle is quality, cost, and access. And everything that we do is within that triangle, okay? So when you look at, and how many of you out there are actually a telemedicine provider or in the telehealth technology space? Raise your hand, okay? Now, I guarantee you that your companies offer one portion of the solution in healthcare, okay? You don't provide a comprehensive solution. But everything that you'll see out there, everybody that's out there trying to sell something or that's going to come to you, it falls into that triangle, okay? And I'll tell you, we don't do direct-to-consumer business, so I'm not here to sell you anything, okay? But give you a perspective on where I think telehealth and telemedicine is going. But as I said, need will accelerate and proliferate the technology, okay? And so you're going to see a lot of new things coming on. This picture sums it up. We're going to space. Well, you can't carry an entire clinic to space, okay? How are you going to provide health care to astronauts? You've got to have technology to be able to do that. And so since the advent of the telephone, and people credit Alexander Bell for that, but there are some that will argue with you and tell you that it was an Italian guy, Antonio Mucci, who came up with the telephone. right? And prior to the telephone, it was the telegraph. And so since that invention, okay, the technology was available. People found different use cases and improved the technology. And in the 60s, NASA took on telemedicine, okay? Some of you weren't around in the 60s. I know I wasn't around in the 60s. But if you were around in the 60s, you knew what NASA was doing. We were trying to put people in space, on the moon, but you also had to take care of the astronauts, okay? And then in the late 70s, really the government started looking at how can we use a technology to help rural areas, okay? And it wasn't until the late 90s or the late 80s, early 90s where Medicare, which is the largest payer in the country, took interest in telemedicine, okay? All right, I don't know if you can hear this. Can we turn up the volume?
You need treatment immediately. But if you're like most patients, getting treatment often means waiting days or even weeks for an appointment. Then the inconvenience to get to their office and wait in a room filled with sick people just to be seen for a few minutes. What if it were simple? What if you could be seen without the wait times and inconvenience, without even leaving your home? Introducing EVisit, your medical professional's simple solution for providing you high-quality, convenient care on your schedule. Getting a prescription refill or urgent treatment for minor medical issues only takes a few minutes, like it should. With EVisit, seeing your medical professional is as easy as logging into your account, answering a few questions about your condition, then clicking the Request EVisit button. Your medical professional will receive your request and let you know when they're ready to see you. Then, we'll connect you through high-definition, secure two-way video from your computer or smartphone. They will diagnose your condition, answer your questions, and if needed, we'll send a prescription to your pharmacy, so it's ready to pick up when you arrive. It's that simple, and you can rest easy, knowing that your health information is safe and secure. EVisit is 100% HIPAA compliant. Make your life easier. Ask about getting an EVisit account today. EVisit, your healthcare visit simplified.
So, this company's still around. You can still go and create an account, and if they service your area, you can get an EVisit, okay? So it has improved access and convenience for patients that don't want to leave their home, okay? And if you think about some of the individuals out there that have very, very busy schedules, okay, and they can't take their kid into the urgent care if they got a earache, guess what? Now you can do this virtually, okay? So if you look at the telehealth landscape, look at all the companies that are out there. And this is probably only 30% of the companies out there offering solutions in each of these spaces. So telemedicine, you'll see some big names up there. Philips, GE. I'm sure a lot of you that are in the United States and some of the companies where Teladoc operates, you've heard of Teladoc, okay? Doctors on demand. So do we have a need in this space? We absolutely have. Otherwise, these companies wouldn't be around, okay? So that's the telehealth landscape, but let's just take a segment of telehealth. Because telehealth, and the next slide will we'll kind of break it out. Telehealth is a very broad term, and that encompasses a lot of different things. Telemedicine actually is the practice of medicine virtually. So you are getting assessed by a clinical provider. They are going to examine you in some form or fashion, okay? And they will deliver some type of treatment, whether it's just advice over the phone or prescription at the pharmacy. They will provide a plan of treatment for you. But if you look at the telemedicine market, okay, in 2019, around the world, $45 billion, okay? It's expected to, by 2026, $175 billion, okay? So this is just the telemedicine segment. We're not even talking about the entire landscape of telehealth. And the North America value is $27 billion. So I'm going to give you a stock tip, okay? If you invest in stocks, and if you lost your money at the table today, go out here. I've seen some papers out here by companies that want investments, or go to the New York Stock Exchange or your broker account, invest in one of these companies, because it's only going to grow. It's not going away, okay? One of the things, if we look, and the hardest thing to change is behavior, okay? As a practicing physician, I look at behavior and you're trying to get compliance from patients. And patients don't comply. Why? If you want their health to get better, how is it going to get better? You've got to change behavior, right? And that's what COVID-19 has done, and we'll talk about that. All right. So telehealth, broader term, there's a lot of applications under telehealth. I don't know if any of you used one of your lab portals to check your lab result. That falls under telehealth, okay? If you're using any devices, there are devices out there. Has anyone heard of Apollo Neuro? It's a device you wear on your wrist, okay? It gives you a little vibration through your wrist, and it's supposed to help with sleep, help you relax, okay? There are a lot of different applications out there under telehealth, but I want to focus a little bit more on telemedicine today. It is a subset, and that is where COVID truly has made an impact. And so if we look at telemedicine, it really is, like I said, you're assessing and you're treating, okay? And the other aspect of telemedicine is if it is not a clinical provider like a PA, nurse practitioner, physician, and you're not being seen by a clinician, there are support services that our company offers. There are standalone companies out there that will offer what they call care management services, okay, to support the patient, to help them coordinate their care. When the pandemic hit, this is a component, remote patient monitoring and chronic care management is a service that we offer our population, okay? When the pandemic hit, and we did this in-home, we saw patients every 2 weeks in their home. There was an RN in the home talking to the patients, assessing their home environment. There was a care plan. When the pandemic hit, nobody wanted us in the home. Nobody wanted us in the home. And so what do we have to do? We had to adapt. All of our visits, starting February of 2020 till around May, were all either telephonic or through Zoom. Okay? So the pandemic did change a lot of things. But telemedicine, and if you look at all the different specialties, and this is not new, okay? A lot of you might be out there saying, I've seen this stuff. I've experienced this stuff, okay? But during the pandemic, critical care, if you ever walk the floor of the ICU, you know how sick these patients are, okay? So the technology, the doctor was not at the bedside. There was a nurse, there was video conferencing software that the nurse would take to each of the patient's rooms, okay? The vitals, the information that the physician needed was transmitted, really not because the physician was scared of contacting COVID. They wanted to decrease the transmission of COVID, okay? So critical care. Do you think you can ever provide critical care, through telemedicine? I wouldn't have thought it, but the pandemic, they found a way to do it. Psychiatry. Yesterday there was a great speaker talking about, self-care and psychology. This is huge. During the pandemic, a lot of people, because of isolation, experienced mental health conditions. But even before the pandemic, there was a push in healthcare to integrate behavioral health with physical health, okay? Mental health with physical health. And there were a lot of providers out there that were providing primary care, but they were also bringing in mental health services into their clinic. So whether it was a psychologist or a psychiatrist, they were trying to integrate it, providing whole person care, not only focusing on the physical aspect of their health care, okay? Look, I'll tell you, surgery. If you've heard of the Da Vinci robot, the surgeon's not cutting the patient. The surgeon's sitting in the back in a room operating devices and maneuvering the robot to do the surgery. Do you think at some point the surgeon's going to be sitting in their home, they have the devices, and be able to do the surgery? Absolutely. As the technology improves, that's going to happen. So all these areas are going to continue to grow. Cardiology, they're already doing it, and they have been doing it. Telemetry, if you know what telemetry is monitoring the heart rhythm, okay, with EKG leads to see what the heart is doing. And if you've had a family member, or if you've ever had any heart-related conditions and you get admitted to the hospital, they hook you up to these devices. The nurses monitor it on their screens from the nursing station, okay? You have a monitor in your room as well. Now these guys can monitor this at home. So there is a lot of use cases for telemedicine. Okay? The problem historically before the pandemic is these technologies were around, but no one was truly paying attention to it. Why? Because it wasn't that big of a need. And when we start talking about what COVID did to the healthcare system, especially providers, it will make a lot more sense. Okay, so when we talk about telemedicine, okay, there's telemedicine between clinicians, from clinician to clinician. If I need a subspecialty service and I'm a rural hospital, I can bring in a subspecialist to be able to consult and provide better care to the patient. Okay, and some of the areas that they've done this, and I've seen this in primary care even prior to the pandemic. Dermatology, you can get a curbside consult. You can load up a picture and get a dermatologist to look at it, tell the primary care doctor what they think it is. Okay, what kind of rash is it? You know, so radiology is the same thing. You can get a X-ray done. Primary care doctor may not know how to read it, or another specialist may not know how to read it, but you can get a radiologist to consult with the physician to tell them what they see on the X-ray. Okay, and even surgical peers. So in some of the rural areas where you've got a surgeon that's out of residency, they need additional backup from an experienced surgeon, they'll bring them in. Okay, video conference them into the OR to help them. Okay, and we already talked about critical care. So, clinician to patients. Okay, this is what aspect of telemedicine that has exploded during COVID, and I'll show you some of the companies that have seen a lot of growth, okay? But nothing more to be said. You saw the video, you can call you can schedule an appointment, see the physician, and get treated, okay? I don't want to spend too much time there. The other aspect of telemedicine, telehealth, this is kind of combined because there's a lot of devices out there that will collect data on your patient. Okay, in terms of whether it's from a compliance standpoint. I remember 2 years ago when I was here, there was a company that was selling a pill bottle with a sensor on the cap, okay, to find out if the patient's actually taking their medicine. If they opened the cap, they probably opened it to get their medicine to see if they were compliant with their medication adherence. Okay, it's just one use case, but now there's so many different things out there. There's the Calm app. There's other apps out there that your doctor can get some useful data, or they may even direct you for self-help, okay? I want you to think about this. When you see your physician, whether you've done a telehealth visit or whether it's in person, how much time do you spend with your doctor on the visit? And then think about how much time you spend with your physician or clinician on a yearly basis. Anyone? How much time? 15 minutes? Raise your hand. An hour? 30 minutes? 20? Okay. Add that up over a year. How much time is that? Maybe an hour, maybe an hour and a half that you spent with your provider? Do you think your clinicians can do a good job in an hour and a half, especially if you're a senior or you got complex medical problems? No. Okay? That's why a lot of these technology solutions do help better manage the patient without having to spend the additional time with the patient. Okay, so COVID-19. You remember I told you about behavior? Okay, this applies to providers as well. If you can't, until something serious happens, patients don't change their behavior. If you've had a family member or a loved one who's had a heart attack, okay, and they were a couch potato, eating greasy foods, they knew they had clogged arteries, did they change their behavior? No. Not until it was serious enough, okay? So when COVID hit, it impacted the pocketbooks of the providers, okay? Cano Health, and if you look at healthcare news, they just went public for over $1 billion. They're a primary care group that contracts directly with health plans, takes risk, and manages their population. Prior to the pandemic, only 1% of their visits, and they have over 20 some odd clinics, over 50 providers, only 1% of their clinics were telemedicine, okay? By April of 2020, 90% of their visits were via telemedicine. Why did their behavior change? Because no one was coming to the clinic. People were scared. I think there's a use for media, okay? And if you watched all the news about COVID and the impact of COVID around the country, it scared a lot of people. People weren't going to the hospital. People weren't not going to see their primary care doctor. And so, you said it, survival of the fittest, Darwin's theory. If you're going to survive the pandemic as a provider, you had to adopt the technology. You had to use the technology. We have an office here in Vegas. One of the docs, his revenue dropped by 60%. Okay? 60% during the pandemic. Can't keep his doors open. Primary care doctor. You know what he did with his free time because patients weren't coming in? He hired 2 developers to provide a network tool for payers in terms of referral management. Okay? And then he was selling that to local payers. And then he jumped on the telemedicine bandwagon and started seeing visits to get his revenue back. I told you Medicare was the largest payer. Medicare gave advances to physicians during the pandemic that had lost revenue. So last 3 months of your average revenue that you got from Medicare, they paid you because they wanted the physicians, and these small practices could not stay afloat, so they advanced the money. Okay? Have you guys all heard of the CARES Act 2? Okay? There were $200 million allocated for medical providers and medical companies that instilled and deployed telehealth. So that also helped increase the utilization of telehealth and telemedicine. Okay? Oak Street Health, another company out of Illinois. Okay? And if you're from the Midwest, you've probably heard of Oak Street. They're also trying to come into Vegas. 0 visits, okay, before the pandemic, telehealth. And they're a very large primary care provider. In 10 days, they grew it to 94%. Okay? The payers and the governmental agencies, they relaxed their rules about being paid under telehealth, and that also contributed. But as I said before, 97% of the medical practices nationwide lost revenue. And that is what helped change their behavior, adapt technology that was already there, but no one was really using it. Okay? So we're not going to get back to pre-pandemic where your providers are not going to offer telehealth. They will. It'll continue. And we'll talk a little more about some of the issues to consider. So, as a consumer, when you're out there looking for a provider or you're looking for a health plan, and I know you all are taking pictures of the slides, but I'll be happy to give you the slides. Email me. My email's on the end, and you can have the slides so you don't have to continue to take pictures. But it will be a way that you decide which healthcare system you're going to work with, which provider you're going to pick. If you're an employer, you might figure out which health plan is better, who's providing more access versus telemedicine. And if you're an employer and you want to decrease absences from your employees being absent, leading to loss of work productivity, you're going to pick a plan that's offering a robust solution. So it's here to stay. It's not going anywhere. And people will market different solutions, different innovation to get your business. Patients will also have the ability to choose. They will have the ability to choose their healthcare provider. If I'm a very busy person and I want to do all my visits via telehealth, then I'm going to pick a provider that does offer that capability. Okay? And those providers and healthcare systems that embrace this technology, they're going to see the most growth. So this is not going anywhere. The one thing I will tell you is that even though the technology sounds great, the technology provides a solution. Medicine is still a hands-on profession. Look at Siri's talking to me now. But I will tell you that safely, 40% of primary care visits can be done via telehealth. Okay? Will you ever see telehealth and maybe AI infusion take over and not have providers, clinicians? No, I don't see that, at least in my lifetime, okay? But there is a place for telemedicine and telehealth, and it could get to 50%, but safely 40%. And I'm going to show you a video later, it's comical, but it does bring out some serious issues associated with telemedicine, okay? Mobile healthcare kiosks. These are popping up. I don't know if you've seen these. These are coming up. There's no provider in there. It's through telehealth. You walk in, you sit down. There might be devices. There might be a mobile stethoscope that you can put on your heart to listen to your lungs, okay, a pulse oximeter, and some other devices in there that will help the provider conduct a visit. What's coming down the pike? Have you, any of you, or are in any markets where Domino's offers this little unit, right? Has anyone ever used it? Where the pizza comes, it's a self-driving unit, the pizza's warm, you open it up, you get your pizza, close it, and it goes off, okay? There is a hospital system in Boston, Grace Hospital. They are now testing a mobile clinic that you can order off of your phone for a visit, okay? And this is what it looks like. You'll have your phone, you can order it to your location. Is it cost effective? Probably not. You sit in there, you can see your vitals, you can talk to your provider, okay? This is where technology is going. And this is not going anywhere, and this is telemedicine, right? Whether you walk into a Walgreens or a CVS and sit in a kiosk, or you walk into an outpatient clinic somewhere where they don't staff them with providers. There's a company that has about 100 clinics out there. You walk in, it's staffed with an MA, but you see your provider on the screen. So various different solutions out there. Now, with telemedicine, there are issues that you have to consider, okay, from a legal standpoint. And one of that is licensure and jurisdiction. Whether you are a provider based in the U.S. treating someone in a different country, if that other country requires you to have a license, then you better have a license because you can't practice and you can't provide the services. This is what these companies are going through now. And if you look at a company like Teladoc or Doctors on Demand, they have over 1,000 providers in their network. And so if someone is sitting in California but they need a visit in New York, they'll find a provider that's licensed in New York and licensed in California, okay? Now there are several states that have a medical licensure compact where it makes it easier, but you got to consider it. So you can't, if you're a provider and you're a solo practitioner and you have a patient that's visiting Texas from Arizona, you're not going to be able to do a telehealth visit because you don't have a license in Texas. So these are some of the things to consider. One of the ways that they are getting around this is a physician-to-physician consultation, okay? Where if there's a provider on the other end, maybe a PA and your doctor's sitting in another state, you can figure out a way to work together to be able to provide those services, okay? HIPAA, data security, huge. If you're transmitting all this clinical data, you've all heard about the pipeline attacks, cyber attacks, ransomware. So you have to have good data systems and cybersecurity to make sure you're protecting this data. Because if there's a breach, you're liable. Okay, you're liable. And under HIPAA, if you're familiar with HIPAA, if it's accidental, you're not going to do prison time. But if you didn't do your due diligence and someone hacked your system and you knew there was a problem in your system, you could serve prison time. It's negligence, okay? So it's something to consider. The other thing is patient consent. When you do a telemedicine visit, does your patient understand what's going to happen at the visit? You can get a digital consent, but is that enough? And I'll tell you that the best practice for patient consent is to document it in the medical chart. So if you have providers and you have a group and you are getting digital consent, you might really want to think about having your providers document that they talk to the patient, they identify the expectation of the visit, what to expect, what's going to happen, what they're going to do, what the limitations are, and document that in the medical chart, okay? And document that the patient consented. Because if it becomes a legal issue, a digital consent might not do the trick. Consider that. Digital divide. There are pockets in our country that don't have broadband access, that don't have cellular access. So they can't participate in telemedicine or telehealth because they can't afford it. However, you heard a speaker yesterday, their company, that's what they're all about. Giving these tablets, these phones, to be able to deliver services and telemedicine in these rural communities. Something to think of. And if you are a provider, one of the things that you have to consider is payment parity, okay? Which means that telehealth visits, historically, have never been reimbursed to the level of a face-to-face visit. A lot of payers have changed that, and that's changing slowly. But at some point, that's going to be a big issue. And I will tell you, the second largest health plan in the United States right now for telehealth visits, they've seen the growth. And if you're familiar with prior auth is, okay, these health insurance companies, the second largest health plan now is instituting, if you want a telehealth visit, your provider will have to get a prior authorization, okay? Because they sense there may be some level of abuse. And they know, like I said, 40% can be done safely, but you will still need to see a provider face-to-face. Okay, let's see if this video works.
Hello there.
Hi, I'm Dr. Gorman.
Hi, I've never really done the online doctor thing before.
No, not to worry, it's exactly like a normal doctor's. No differences whatsoever.
Really?
So, what seems to be the problem?
Yeah, I found something down there.
Okay, well, we just take a little look, will we?
Okay.
Alright, so just hop up on the bed there behind you and slip down the trousers, okay? Quick as you can, Paul. Okay. Right, so, any plans for the long weekend, eh?
What?
Just cough for me there. No, I don't feel anything. You're in the clear. So if there isn't anything else?
Well,
Perfect. Okay, Paul. Okay, Jerry, you tell me you have a rash.
Yeah, on my arm.
Oh, can I have a little look there?
Okay. There. Do you see that there?
Okay, now with the texture, Jerry, would you describe it as medium rough or mild coarse?
I don't know.
Okay, I need you to be exact, Jerry, okay? Medium rough or mild coarse?
I'm not really sure.
Just take a breath, Jerry. This is very, very important, okay?
Mild course.
Oh, that is a relief. I tell you, if that had been medium rough, would have been straight to the emergency room. Well, look,
Right.
if anything else crops up, you just let me know, okay? Bang me on an email.
Because
So
I'm
look,
not really sure.
now, Jim, what seems to be the problem?
I think I need glasses.
Okay, well, we'll check that out now. If you wouldn't mind, please, just reading this chart.
It's all out of focus.
All of it.
Yeah, even you're fuzzy.
Oh, goodness, now, Jim, that doesn't sound good. That's very bad.
I know you're back in focus now.
So I'm coming in and out of focus?
Yeah.
Okay, this could be serious.
I'm definitely still feeling something there, so is there maybe another way you could check?
There is another method. It's much simpler, actually.
Great, yeah.
Okay, if you could just pee into this cup.
Sorry, I can't.
Oh, of course.
Yeah.
You need some privacy. I'll leave the cup here. I'll be back. Hello again, Jim. So we got the test results, okay? Are you sitting down?
Yes.
Okay, well, it's very serious.
Sorry.
43%
You cut
fatality.
out there.
Extremely careful. Instant death.
I didn't
Three
get that.
of
Hello?
these tablets.
I'm not getting that now.
More.
Sorry.
I will say it one.
It's very bad line.
Okay, have you got that?
The line is very bad now.
Good man. You'll be fine.
All right, so comical, but serious, because things will happen because telehealth, telemedicine, you can't provide the level of care that you can on a face-to-face visit. You're not going to have teleportation or teleporting the urine cup into the patient's home, having them pee in the cup and then teleporting it back. Technology doesn't exist. When it does, maybe, okay? So there are risks associated with telemedicine. And there was a study in 2015 around dermatology, okay, where included 62 doctors, 16 different telemedicine platforms. They failed to accurately diagnose the condition. And if it's misdiagnosis, the providers will get sued, okay? You're not providing quality care. So the point is, if you're going to do telemedicine, make sure you know what the appropriate type of patient is for telemedicine and those that are not. Those that try to push everything and will do telemedicine for every type of visit, it's not going to work, okay? So be cautious. Now, lawyers, and if you go and Google, and you will see, and I don't know if you watch television while you've been in Vegas, there are tons of malpractice lawyers. They're all advertising, well, if you were impacted by this prescription, call us. We've, recouped millions of dollars for our patients. Well, there are companies out there now that are advertising about a visit you may have had or a patient may have had via telemedicine, and they're ready to take your case if you were harmed, if you were misdiagnosed. You've got to consider that, okay? So, and the last thing I will tell you is that there is power behind human interaction. And for providers that are in the healthcare space, I don't care what anyone says. We can have a long debate. Human interaction in healthcare is necessary. And there are studies that show that people, just by human touch, feel better. So, is the human interaction portion of medicine ever going away? No, it's not. At least not in my lifetime, okay? And unless technology comes around and can create the same level of response out of a human being that the human touch can create from a digital standpoint, maybe, okay? And so with that, I will end. My email is up there. Email me. I will email you the slides, but that's my perspective of telehealth and telemedicine. So thank you for your time. Thank you for your attention this morning.